Something just kind of made me speak up, and as I did, they did another ultrasound, and unfortunately that was positive for invasive ductal carcinoma. To know that it had metastasized was scary, and I really believe that had we picked it up, that 6-7 months earlier, that probably wouldn't have been the case, and I might have been able to spare myself chemotherapy. I had chemo and surgery, double mastectomy, chemo and radiation.
Every day I had to double check my meds because what they had in the medical records on the machine they brought in was different from the meds that I had in my record that I knew I should be taking. So I always had to be double checking and making sure that my meds were correct. And that should not happen.
I looked at my labs because I was fortunate and I worked at the same facility where I received my care. And I saw that I was in acute kidney failure. I'll never forget, she said, "Michelle, I don't know what to do with you. You're the doctor, the nurse, and the patient all wrapped up into one." Not everyone can say that. So how do we provide the best care and prevent near misses, mishaps, and outright egregious mistakes from happening?
I called the office on 4 separate occasions to say how sick I was. I couldn't get out of bed. I couldn't walk. I lost 20 pounds in 3 weeks. And they said, "Take an afternoon nap. You had major surgery." This is before we knew about the infection, etc.
It just seems very beyond comprehension that what was initially regarded as a simple hysterectomy could spiral into all of these multiple issues, some of which were completely ignored, right, by the physician team.
Reading in the notes, it said, patient advised to call if she continues to have, pain. Well, I did. I feel like I really did. and it didn't seem to matter.
Is interesting and almost sad about the story with my first son is I worked at the hospital that I gave birth to my first son at, and they were near and dear to my heart for a very long time. And my experience was so bad that I removed all of my care from there.
It's not just about the person who's in a hospital bed, it's about the safety of everyone around them as well. We're so focused on the efficiency of the system, we don't really look at the effectiveness of the system or its direct impact on the people who are receiving care or providing care. And we'd spend more time looking at the human impact and not just the efficiency of the service. I think that would really go a long way to help safety.
And you carry around this stress, this worry, this self-doubt, and it really interferes with your work. It's very hard to be an effective clinician when this is all going on in your head. Systems can set you up to fail the way they're set up. And that took a long time to learn about and realize that it's not all on my shoulders.
There absolutely is a way to fix. One is we have to all be accountable, from the CEO at the top of the organization down to the volunteer that's greeting people at the door. All of us have a sense of duty and commitment to our patients.
I will continue to talk about how broken the system is and how there are ways to fix it. And there are ways for things to just be standard care. It should just be the same for every person walking through the door, every birthing person.
Ideally, it's also got to be an equitable system that recognizes racism and ableism and barriers faced by linguistic minority populations.
The direct financial cost through this whole process, not only on the patient, but also on the system, was just absolutely outrageous. I mean, when you think of all the hospital stays that, in hindsight, were really unnecessary.
I think to move forward, we've got to keep working on this and keep using the systems we have, and that's how we're not going to make change if we just bury our head in the sand.
I can understand that we do make mistakes, But when we're not accountable and we don't answer to them, how do you expect us as clients, as patients, as people to have faith in a system that's not supposed to let us down?